Okay, so that's sort of the basic overview about what your choices are, the first choice you have when you're thinking about Medicare. And so now a lot of people will say to me, well, what should I choose? And again, this presentation is meant to give you education. It's very difficult to say what any individual person should do when it comes to Medicare. But we can tell you like the pros and cons of each option. So first of all, if you go with traditional Medicare, one of the big pros of that is that your costs are fixed. You know what your Medicare card costs you. And I should mention that your Part B premium, that $144 that you pay, you will pay that out of your Social Security check no matter which option you choose. So that is sort of a given. No matter which option you choose, that $144 for your Part B premium will come out of your Social Security check. But when it comes to your supplement plans, if you choose this option, the way the private companies that sell supplements make their money is through their premiums. So your costs are at the front end. You choose your premium. If you pick a very comprehensive premium that might cost $250 a month, no matter what happens to you, if you go in the hospital, you fall on the ice in February, you break your hip, you need surgery, you need rehab, you go by ambulance, all these places, when you come home, you can open your mailbox and pretty much be assured that there will be no bills in your mailbox. You have paid for that luxury every month up front by paying a pretty hefty premium. And also, if you choose your Part D plan wisely based on your medications, and you pick a plan that fits your needs, your costs for this option are quite fixed. You know what they are, they're upfront about it, even though they might be a little bit higher. You can see any doctor. Another pro of picking this type of option is that you can see any doctor you want. You can go to any doctor that accepts Medicare. You can use any provider. You can go to any hospital. You can go to any lab that you want. Again, it's as long as Medicare, that provider accepts Medicare, you can go there. It works anywhere in the United States. Because it's a government plan, you can have your accident in Arizona and receive care there, come back to Connecticut, finish your care, and you're fine. The other huge advantage of this type of choosing this option is that the government calls the shots when it comes to paying for your care. So in other words, all of the providers that have for years and decades accepted traditional Medicare know all the rules that Medicare has in place about what kinds of service they can provide you and what Medicare will pay for. So in other words, if you were to come inpatient here and go on our rehab unit, the physical therapists know what the Medicare rules are. They stay within those rules, and again, the government has called those shots for years. The providers know them, and everything is pretty cut and dry. The problem is over here with the Medicare Advantage plan, that's not the case. One of the big cons of Medicare Advantage plans are that these private insurance companies are calling the shots. If you were that same situation, if you were on an inpatient unit somewhere getting rehabilitation, that private insurance company is calling that facility probably on a weekly basis to get an update about how you are doing. And when they feel, again, not necessarily your doctor or the professional staff on that floor, when that insurance company feels your time is up, then your time is up. So it's not the government and your healthcare providers making those decisions in many, many ways, and many times it's the insurance companies that are making those decisions. So that's a big con over here for the Medicare Advantage plans. The other things that happen is you will see a lot of heavily advertised, very low cost premiums. So, some people say, well, that's a good thing. However, your costs are sometimes very unpredictable on this side. If you look through, when you look at this material, if you look through the grid of what you're going to owe, you will find that they are going to make their money through co-pays and co-insurances. So while these plans made it through your premium upfront, these plans are going to make money from you on the back end. So they might charge you a zero premium, but the ambulance ride to the hospital, you'll come home and find a bill in your mailbox for $250 for the ambulance ride. You will find a bill, if you bought a zero premium plan, the first 5 days in the hospital will probably cost you about $250 a day. When you come home, you'll find that bill in the mailbox. You'll probably find bills from a number of the doctors that saw you. If you go to rehab, if you stay for an extended period of time, you'll find bills from them too. So, in other words, these companies are going to make money from you, even if you buy a zero premium plan, but they're going to make it on the back end. Two things about that is because none of us have a crystal ball and we don't know what's going to go wrong with our health, it makes these plans and the costs with co-pays and co-insurances much more unpredictable. And it also leaves you with the onus of figuring out what you owe. When you pay your premiums over here, you know what you need to pay. But when you come home and find all these bills in your mailbox, some of that onus is on you to figure out what you actually owe and what you don't. The insurance company is supposed to be keeping track so that you never exceed a maximum out-of-pocket cost for a year. But again, those bills will show up in your mailbox, and a lot of the onus of knowing what to pay is on your back. And when I talked about maximum out-of-pocket costs, that's important. When you pick a zero premium plan, again, this company needs to make money from you. They're not going to make it from the premium. They're going to make it with your co-pays and co-insurance when you get ill. And most zero premium plans have a maximum out-of-pocket cost near $7,000 a year. If you get a more expensive premium plan, that maximum out-of-pocket cost might go down to about $4,000 in the course of a year. But again, those zero premium plans, they do that to hook you in, but then if the worst goes wrong for you that year, you can wind up paying about $7,000 out of your pocket. And remember, if you're a couple you each buy one of these plans, you could each spend $7,000 out of pocket in the course of a year should the worst go wrong. So those are the pros and cons of a lot of these. These plans, I should say, don't travel as well as traditional Medicare. You have to be very careful. A lot of these plans, you're not going to get care out of state. They might offer you emergency care, but then you have to get back to Connecticut to get the rest of your services. One other thing I should say, the difference between, and this is a pro for Medicare Advantage, I have to say, that when you are in the hospital over here, and let's say you do need a rehabilitation stay, you do have to be in the hospital 3 overnights, 3 midnights. You have to be in the hospital in order for traditional Medicare to pay for an inpatient rehabilitation stay on a skilled nursing unit. Most Medicare Advantage plans do not have that requirement. So that is one advantage of these. So I guess in summation, I would say as far as the pros and cons of this, some people will say to me, they'll come to me, they're just turned 65 years old, they've been very healthy for 65 years, maybe they've never been in the hospital or they've been in the hospital once in their lifetime. It's very hard to say that the Medicare Advantage plans won't be a cost savings for them. Of course, we don't have a crystal ball. We don't know what could happen in any given year. But if they choose a zero premium plan, they see their primary doctor once a year, they don't have any specialists, so they have a $15 copay to go see their primary doctor, you can imagine that when they're young and healthy, they might get away with these plans. They might do very well with these Medicare Advantage plans. You will, however, find people as they get older and sicker, maybe diagnosed with a chronic condition, you'll find them during each open enrollment period thinking about this decision and maybe migrating back to traditional Medicare. Because again, while their premiums might be high, their costs are fixed. They don't have to worry about $7,000 times 2 every year should something go wrong. They've been in the hospital, they might need to go again, they might need an inpatient rehab stay. It gets more likely as you get older and sicker. And so these plans then you'd be more confident that you won't incur $7,000 a year per person for costs under these plans. So that's the basics of your first decision when it comes to Medicare and Medicare Advantage plans. I do just want to caution you, if you are a retiree of certain groups, for instance, I'm thinking of the state of Connecticut and some teachers, I know you don't have options at this point. Your retiree benefits have pushed you into, in Connecticut, the United Healthcare Medicare Advantage plan. This information is good for you too, because you might want to talk with your unions or your retirement organizations and advocate for more choice for yourself in retirement. And again, if you need more information about any of this, your personal health coordinator can help you. Medicare's website, medicare.gov, is a wonderful resource. Your Medicare and You handbook is a good resource. The Connecticut Insurance Department is a great resource. There's also other private nonprofit agencies, for instance, the Center for Medicare Advocacy. That's a wonderful agency and a good place to get additional information. Thank you very much.